I usually get this question on my YouTube channel where people ask me, how can I know if I'm going to shed while taking hair loss medication? How can I know if I have scalp inflammation or inflammation around my hair follicles? How do I know if my hair follicles are responding to treatment? And before all of this, I would say that, well, there isn't a real way to figure this out. However, I'm happy to say that I'm wrong and that this is very possible using ultrasound imaging. Ultrasound machines allowed for the researchers to observe important things such as patterns of fibrosis, also known as scar tissue, in the scalp. They also could see inflammation in the scalp and the movements as well as areas of blood flow using colored Doppler technology. I think ultrasound technology has a huge applicability in tracking if somebody's going to shed hair, if somebody's going to lose their hair, if somebody's having a response, a positive response that is to treatment, or if somebody is going to be dealing with inflammation of their hair follicles and their scalp, or maybe they're already dealing with that right now. Hello everyone, and welcome back to yet another video. This video will concern the use of ultrasound technology in combination with a method known as skin taping, used together in dermatology. Now, these things aren't necessarily new, especially ultrasound technology, but I do think it's underutilized, especially when it comes to hair loss. Please give me the time to explain, so you can have a look at the timestamps for this video in the description if you need help navigating the topic at hand, because I think there's some really important implications here that might be relevant to patients, physicians, researchers, as well as the hobbyist scientist, such as myself. I've consulted with many people, including industry researchers, who for whatever reason seem to find my service worth the spend, so forgive me, but I'll plug a link to my consult if you would like to talk to me. Also, I will be adapting this video as an article to my new website blog called CognitaRx, and I'm currently hiring people if they, want to write articles there as well, so you can email me regarding that and we can work something out. But that's the only time I'll be doing a self-plug in this particular video, so don't run away just yet, okay? Anyway, how does ultrasound technology work? Well, let's start off by understanding how ultrasound technology works. Sonar, or sound navigation and ranging, which is what the acronym sonar stands for, right, is a technique that uses sound waves to map or locate objects in water. It's widely used in marine navigation and fishing, where pulses of sound waves are emitted, bounce off objects, and return echoes that are then analyzed to determine the distance, size, and shape of an object. Interestingly enough, bats use similar processes known as echolocation to navigate and interpret their surroundings. Bats emit high-frequency sound waves from their mouths and noses, and these frequencies of sounds are typically well above the range of human hearing, so they would really range from 20 kilohertz to over 200 kilohertz, where 1 kilohertz is equal to 1000 hertz. So this isn't a math video, so don't really get too deep in the weeds, but just keep that unit in mind. After emitting these ultrasonic sounds, the waves travel through the air, bouncing off of objects, and then returning to the bat as echoes. Bats have highly adapted ears which are capable of detecting these echoes even in noisy environments. And the shape and positioning of their ears help them pinpoint the direction and distance of objects with remarkable accuracy. When these echoes return, bats process the information extremely quickly in their brains to construct a detailed map of their surroundings, and the time it takes for an echo to return helps the bat determine how far away something is, while the pitch of the echo can indicate the texture and density of the object. So this is some really cool, superpowers, or animal superpowers, if you will, right? And similarly enough to nature, ultrasound imaging uses the same principle but adapts it for medical use to visualize internal body structures. So how does ultrasound technology work? Ultrasound imaging and ultrasound technology involves high-frequency sound waves that a handheld probe emits. These waves travel into the body and reflect off of tissue at different rates depending on their density and composition. When these sound waves bounce back to the probe, they create echoes that are captured and interpreted by the ultrasound machine. The precision of these echoes, both in clarity and timing, is crucial because they determine the quality of the image that is produced. Because the more accurate these echoes, the clearer and more detailed the ultrasound images are, which is essential for diagnosing various medical conditions by providing intricate views of tissues, organs, and even blood flow. The receiver in the ultrasound machine plays a critical role here because it interprets these echoes such that it can produce visual representations of the internal tissue. And it also distinguishes between the different densities and compositions, allowing for healthcare providers to differentiate between what is fluid-filled structures, soft tissues, and even more solid masses. An advanced feature of ultrasound technology would be Doppler ultrasound, which specifically measures changes in the frequency of echoes caused by the movement of objects such as blood cells. And it is this method that is crucial for assessing blood flow and identifying vascular issues, such as inflammation. Now, with color Doppler, it takes this whole concept a step further because now we're adding color to the echoes, enhancing the visualization of blood flow dynamics in real time. So the probe would essentially interpret it like this. Blood that's moving toward the direction of the probe, where the emission is coming from, is usually displayed in red, and blood moving away from the probe is shown in blue, with variations in color intensity indicating the speed of the blood flow. Now, you may be familiar with this concept in physics when it comes to the Doppler effect. And the Doppler effect is a phenomenon identified by Austrian physicist Christian Doppler in 1842. You see, Doppler initially proposed this effect while studying the behavior of sound waves and observing the change in frequency and/or wavelength of light and sound as the source of that light or sound moves relative to an observer. So in this case, the observer could be the probe itself that's, emitting the echoes and it's bouncing off of the red blood cells and coming back. Then you can kind of get the understanding of the Doppler shift here, right? Or maybe you've probably experienced this yourself when the sound of a passing siren changes its pitch as it moves towards you and then away from you. In astronomy, the Doppler effect helps in studying the movement and properties of stars and galaxies. And finally, more relevant to the channel, in medical imaging, Doppler ultrasound is critical for diagnosing and monitoring the flow of blood and other fluids within the body, and it allows us to detect abnormalities in the cardiovascular system or any sort of vascularized structure. And we can't forget that it's also used in radar technology as well as weather forecasting to measure wind speeds and to track storm movements, which all of this goes to show how, this is some pretty cool technology. We'll also touch on this concept later on when it comes to ultrasound technology, but I'll just bring it up here very, very briefly. When you look at an ultrasound image, you probably see that it's just a collection of black and white pictures, right? I want you guys to keep this in mind and maybe what the black and white aspect of an ultrasound image entails. And keep in mind how in ultrasound technology, you're emitting a sound wave and that sound wave has to bounce back off of something. So try to correlate that and think what that possibly entails when it comes to the coloring of a particular ultrasound picture. So keep that in mind because it's going to be relevant very shortly. Because I want to introduce you guys to a study titled, quote, Sonography in Pathologies of the Scalp and Hair, unquote, by X. Worstman et al., published in the British Journal of Radiology in May 2012. I love this study because it's about the use of ultrasound machines in patients with scalp diseases and disorders. The ultrasound machines allowed for the researchers to observe important things such as patterns of fibrosis, also known as scar tissue, in the scalp. They also could see inflammation in the scalp and the movements as well as areas of blood flow using colored Doppler technology, like we talked about earlier. I think what is most interesting in all of this is that you can see hair follicles and their structures using this ultrasound technology. Not only that, but there are identifiable characteristics that allow for the assessment of what stage of the hair growth cycle a hair follicle is in, whether it's in the anagen, catagen, or telogen phase. So guys, you can see what phase the hair follicle is in terms of its growth. And that means you can possibly predict if a hair follicle is going to, what? Shed. So all those messages I get where people are like, hey, how do I know if I'm going to shed? How do I know if I'm responding to treatment? If you were to somehow do week by week ultrasound imaging of your scalp, you can get a very good idea of the antigen to telogen ratio at any given point in time, and you can possibly predict if you're going to shed by looking at the number of catagen transitional hair follicles as well as telogen resting hair follicles that are about to just let go of those hairs anyway. Another thing that made me really like ultrasound technology in regards to tracking hair loss and hair disorders is that with this technology, you can get a prediction of the spacing of the hair follicles, which gives an idea of the hair density. There's also some potential abilities latent here because you can kind of get an understanding about the number of hairs per hair follicle, which is pretty neat because we know that a hair follicle doesn't always produce one hair and can sometimes produce multiple hairs. And in order to kind of figure that out, you might have to get multiple ultrasound images of the scalp. Now, I'm saying all of this, and I'm showing you stuff on the screen that might make you confused. You might be asking, how is this even possible? Or how do we even know what we're looking at is even a follicle on an ultrasound image or what that structure may be? And in order to understand this, like I said earlier, I wanted you to keep in mind what the black and white areas of an ultrasound image correspond to. Because now we're going to understand the concept of hypoechogenicity. In the medical scene, we already know that ultrasound imaging utilizes high-frequency sound waves to create images of the inside of the body. And these sound waves are emitted from a probe and reflect back what they encounter when it comes to different types of tissue or structures. The differences in how these sound waves are reflected back to the probe can create the images we see on an ultrasound machine. In terms of hypoechogenicity, this term refers to the appearance of a structure when ultrasound reflects fewer sound waves compared to the surrounding tissue. This results in a darker image on that particular ultrasound spot, indicating that the structure is less dense relative to the tissues that surround it. This is often seen in fluid-filled areas or tissues where there's ample amount of inflammation. With scalp ultrasonography, hair follicles can be identified due to their unique structural characteristics. We can tell if they're inflamed or not depending on how dark their tubular appearance is, as they typically appear as small, relatively thin tubular structures in the skin layer, that is, if they don't have any sort of disease. And their appearance changes depending on the phase of the hair growth cycle they're in. When you're using ultrasound technology, you can tell what phase a hair follicle is in by seeing where in the skin strata that hair follicle is, or that sort of tubular circular structure appears, right? In the anagen growth phase, the follicle extends deeper into the dermis and the subcutaneous tissue, showing a more prominent structure. In the catagen transitional phase, the follicle begins to regress and move upwards towards the surface. And in the telogen resting phase, the follicle is at its most superficial position, where it is closer to the outer layer of the skin or the stratum corneum. And these patterns have been confirmed through histological studies and biopsies, which provide a detailed view of hair follicle dynamics. I'd recommend looking at the paper titled, quote, Hair Evaluation Methods, Merits and Demerits, unquote, by Durat and Saraogi, published in the International Journal of Trichology on July 1st, 2009. Another study to look at would be titled, quote, A Guide to Studying Human Hair Follicle Cycling in Vivo, unquote, published in the Journal of Investigative Dermatology by Ji-Won Ho et al., where here we can get more highlights on some very technical occurrences in the hair follicle and its growth cycles. And to be honest, there are some really, really nice pictures and images of the actual biopsy from the scalp skin, where you can see the hair follicles at different points of the hair growth cycle, along with some anatomical structures that are pointed out from the biopsy compared to pictures where they're actually drawn out, so you can kind of get an understanding about what you're looking at, right? And it's in these studies where you can see how the base of the hair follicle, known as the dermal papilla, detaches the hair shaft and how the hair follicle's position changes within the skin layers throughout the different phases of the hair growth cycle. So we can combine all that knowledge and kind of make sense from the hypoechogenicity of the hair follicle, as well as understanding from biopsy reports how anagen, catagen, telogen hairs typically look like. Now, when it comes to the appearance of fibrosis or scar tissue, and differentiating it from other hypoechoic structures like fluid masses or even hair in ultrasound imaging, it requires a closer look at their respective characteristics and patterns. Now, fibrosis in the scalp or any other part of the body typically appears as an area of increased echogenicity in ultrasound imaging, which means that they reflect more sound waves than the surrounding tissues. However, it's important to note that the extent of this echogenicity can vary based on the density and arrangement of the fibrotic tissue. In more advanced or dense fibrosis, the tissue might actually appear as a mixture of hypoechoic and hyperechoic regions due to the complex structure of the scar tissue that includes both dense collagen and areas of less dense cellular material. And by the way, hyperechoic or hyperechogenetic is when a tissue reflects more or a relatively extensive amount of sound waves compared to surrounding tissue. And to get a better understanding of this, I think we should turn our attention to another study titled, quote, Ultrasound Features and Differential Diagnosis for Superficial Nodular Fasciitis, unquote, by Nan Zhuang and colleagues, published in the Journal of Clinical Ultrasound Sonography and Other Imaging Techniques, back in October of 2023. Now, this article is about feet and the condition of fasciitis, which is an inflammation of connective tissue that surrounds the muscles, tendons, and even organs. But it's applicable here because we're talking about skin structures and how, when they're scarred or fibrotic, what characteristics they give off in ultrasound imaging, and the scalp has similar tissue or being fascia in this case. Anyway, we can get an understanding that a combination of hyperechoic and hypoechoic imaging produces various kinds of fibrosis tissue patterns depending on how severe the fibrosis is. And again, fibrosis means scarring. Observable types of fibrosis on ultrasound include linear fibrosis, characterized by streaks of echoic tissue, reticular fibrosis, featuring a web-like pattern, and nodular or mass-like fibrosis, which appears as dense, irregular forms within tissue. Each type provides a distinct visual cue that helps in assessing the stage and extent of fibrotic changes, thus aiding in accurate diagnosis and treatment planning. Now, I want to turn our attention back to the Worstman et al. Study titled, quote, Sonography in Pathologies of the Scalp, unquote, where here we can see some pretty interesting pictures, right? So fluid collections such as those in cysts or edema are usually hyperechoic or even what is called anechoic. And anechoic is when something is completely black on ultrasound. This is because fluid is much less dense than solid tissue and thus reflects very few ultrasound waves. Fluid collections are also typically well defined and can change shape slightly under pressure from ultrasound probing. And this is a phenomenon known as compressibility or deformability. Solid masses, depending on their nature, whether benign or malignant, can vary in appearance from hypoechoic to hyperechoic. However, most solid masses will have some sort of internal echogenetic qualities that differentiates them from fluids. They are generally non-compressible and have defined borders that might be irregular or smooth. An important aspect here is that many imaging techniques can be used, which can give more findings, such as how masses might have internal vascularity when color Doppler is used, indicating active blood flow, which is not typical or possible for simple fluid collections. And Worstman et al. Really goes into this as they look at multiple patients who have varying conditions that they are able to get a sort of characteristic of when it comes to their scar tissue, their masses and cysts, as well as other lesions. They have ultrasound images that show characteristics of specific skin disorders like acne cheilodilus, nuchi, perifolliculitis, folliculitis decalvans, and even skin cancer. And you can kind of see the differences in the images on the screen, and they'll be shown to you. Now, with all of this being considered, we can see that the use of ultrasound technology is pretty handy, and that as a tool, it can help us diagnose scalp disorders, but also examine the state of hair follicles. But this opens up a lot of avenues for doctors, researchers, and patients alike. Again, I usually get this question on my YouTube channel where people ask me, how can I know if I'm going to shed while taking hair loss medication? How can I know if I have scalp inflammation or inflammation around my hair follicles? How do I know if my hair follicles are responding to treatment? And before all of this, I would say that, well, there isn't a real way to figure this out. However, I'm happy to say that I'm wrong and that this is very possible using ultrasound imaging. And again, I've already explained this earlier, but you can get an idea of how inflamed a hair follicle is, but also what stage of the hair growth cycle a hair follicle is, depending on which strata the follicle is in the skin. Where the deeper the follicle is in the dermis and subcutaneous tissue, the more likely the follicle is in a period of anagen growth. And the closer the follicle is to the outer layer of the skin or the stratum corneum, the more likely it is in telogen or resting, where the hair is about to fall out. And anything in between is just a variation of the catagen or anagen to catagen cycle, where the hair follicle is in late anagen growth, so it's still growing somewhat, or it's in some sort of transitional phase where eventually it'll enter telogen and the hair will fall out. And Worstman and colleagues give us a really good graphic over here that gives us an understanding of this sort of process. So yes, you can predict if you're going to shed using ultrasound imaging. You can get an anagen to telogen ratio at any point in time. And I also talked about this earlier, but you may even be able to tell which hairs are terminal hairs and which are vellus hairs. However, with vellus hairs, it might be hard to identify this visually due to how thin they typically are. So it might be kind of hard to view this with the eye due to a combination of their hypoechoic characteristics and the fact that with a vellus hair, it's very, very thin in its width. So it could be hard to kind of get an intricate kind of view of the hair follicle as well as its hairs that it's shooting out. But with machine learning alongside a team of radiologists and dermatologists, it is possible to train an algorithm that can detect hair follicles that are vellus and hair follicles that are terminal. And you might be saying, well, let's just look at the scalp with the phototrichogram. Well, you can do this even more effectively, perhaps, using ultrasound technology to see if a hair follicle is an anagen vellus hair, right? Remember, anagen just refers to if a hair follicle is actively growing. A hair follicle can actively be growing, but it can be actively growing weak, flimsy hairs, right? But a phototrichogram can only show us what hairs are getting out of the scalp, right? There could be hair follicles that are still metabolically active or that are being stimulated to become metabolically active, yet they're only producing these sort of weak vellus hairs, but nevertheless, they're getting some sort of response from treatment. And you can even do inflammation tracking or prediction by using hypoechogenicity and Doppler coloring ultrasound technology. And we aren't living in the past. We can already use machine learning technology in combination with computer vision algorithms that can be used to detect abnormalities and even detect if something is a vellus or terminal hair. We already see this being used in X-rays as well. Take, for example, MIT, also known as Massachusetts Institute of Technology, where their particular lab called the Computer Science and Artificial Intelligence Laboratory worked in collaboration with General Hospital, Massachusetts, to create an artificial intelligence model back in 2019 that predicted breast cancer up to 5 years in advance. And it was able to do this by being trained on the images of people that got breast cancer before. But it was able to find certain patterns by looking at the history of various breast cancer ultrasounds as well as other X-rays to kind of find abnormalities and correlate those abnormalities to the people that actually got diagnosed with breast cancer. So with all that in mind, that created a sort of algorithm that can detect in people who may not have cancer or tumors that are identifiable in the moment, but it could be predicted with some stunning accuracy just by feeding their images to the model that was created off of past people that already had those conditions, right? So in other words, it isn't impossible to develop a more effective screening technique for predicting vellus and terminal hair growth, as well as predicting shedding patterns and how large of a shed somebody may endure. But I'm not done yet, because we need to talk about the use of ultrasound technology in hair loss clinical trials. I want to start off by saying this. In a scientific study, your outcomes are only as good as the methods you use to investigate a hypothesis. If you have a flawed and faulty method, you will get a flawed and faulty outcome. And it is in my experience that hair loss treatment studies are a perfect primer in understanding how the structure of a study can exaggerate and even diminish a treatment and/or intervention. You see, much of observational science involves the use of p-value. The p-value is a statistic that helps researchers determine whether their findings are statistically significant. It essentially measures the probability that the results observed in a study could have occurred by chance if there were no real effect. A low p-value, typically less than 0.05, suggests that the observed effect is unlikely to be due to chance, which supports the hypothesis being tested. Conversely, a high p-value indicates that the observed result could easily have occurred by chance, leading researchers to retain the null hypothesis, to suggest that there's no effect. The use of p-value is common in scientific studies to help assess the strengths of evidence against the null hypothesis, and for those of you who don't know, the null hypothesis is essentially the assumption that we start off with that a treatment or intervention won't have an impact or show some kind of change to what we observe. But again, p-values can only make sense within the context and confines of the methods we use, because the methods we use dictate where we look and how we implement an intervention. So by having better screening tools, it only helps us improve our capability and capacity for observation. And thus, we can have more assurance that the p-values we get in our study methods and designs can give us confidence in saying that a particular treatment or intervention works. It would be great if ultrasound imaging technologies were used in clinical trials. Take, for instance, Dr. Barghouti, Dr. Bloxham, and Dr. Toyos. They are currently running verteporfin case studies on their hair transplant patients. You see, there's a theory that using verteporfin may slow down and reduce the formation and amount of scar tissue in hair transplants. And in doing so, it might be possible to regenerate hair follicles that were taken from the donor area of a hair transplant and transplanted into the recipient area. Thus, in theory, verteporfin could potentially use the body's healing mechanism alongside its own properties to regenerate new hair follicles and thus amplifying the donor area. Now, what better way to prove this being the case by using ultrasound imaging before and after a hair transplant, and before and after the injection of verteporfin? You could possibly do this weekly or monthly to image the scalp and show the structural changes and comparing the verteporfin-treated areas against the non-verteporfin-treated areas. And here, you would be able to prove if there are fewer amounts of scar tissue and structure. And if you do this on a week-by-week or monthly basis, you could possibly see the regeneration of new hair follicles with such an imaging technique. This is important because we now have some pretty effective imaging techniques here that can give more confidence to these case reports and studies, even if they have fewer subjects. Again, remember Worstman et al. In the paper about scalp pathologies and ultrasound technology, and how it shows us how inflamed and fibrotic tissue looks like. Likewise, Nang Zhuang and colleagues shows us this as well with their paper on fasciitis of the connective tissues in the feet. Between these two studies, we can get an understanding on how inflamed and fibrotic scarred tissue exhibits itself in ultrasound technology, and we can even potentially create a grading system specifically for the scalp when it comes to fibrotic regions. And look, this technique could even be used to prove the efficacy of hair growth stimulants, and even proving how many hair follicles were transitioned from a vellus hair to an intermediate or terminal hair follicle. You can even see them activating dormant hair follicles if it's that effective, right, in a particular intervention. Now, this brings me to Amplifica Holdings, or more commonly known as Amplifica, and their hair growth stimulant, the osteopontin derivative AMP303, AMP303, and how it had some very successful data. Essentially, after one injection of AMP303, it was alleged that it altered hair follicles by making them produce non-vellus hairs and making them produce more terminal or intermediate hair. And this is pretty significant, because typically speaking, you would use a phototrichogram to count the new hairs from the hair follicles, and this is a traditional approach, and it works pretty well. But I would argue that showing the structural changes to the hair follicles themselves would also be a good marker. And this could be assessed by using maybe a biopsy, which would obviously give a clear result. However, biopsies are only specific to one area of the scalp. And if you want to have a more comprehensive understanding of the scalp, you can't really biopsy the whole thing, as that would be pretty unethical and also very destructive to the patient's scalp skin. But ultrasound imaging has a huge advantage here, such that we get to see a large area or can apply the ultrasound imaging to a larger area, and we can piece all of that together to understand the hair count, as well as the changes in hair follicle size, and potentially we can see other sort of structural changes as well too. We may even be able to get an understanding if patients are dealing with inflammation or have some sort of latent inflammation condition that could be impacting the effectiveness of the treatment. So, a company like Amplifica could use ultrasound imaging technology to show that the hair follicles that supposedly responded to its treatment had some sort of change to them, because they claim after one injection in a 6-month period of their AMP-303, hair follicles started to produce hairs that were non-vellus and more intermediate and terminal, which again is a pretty significant claim that one injection of AMP-303 did this. I would be more convinced if they used ultrasound imaging technology to show that sort of structural change or activation of hair follicles from dormant to more active states. And really, it might be more effective because there could be some dormant hair follicles that responded but are only producing vellus hairs that aren't really getting out of the skin to any significant extent. So again, this is another way where ultrasound imaging could be pretty effective in the clinical trial setting. And we're not done yet, right? We can also use ultrasound imaging to see the structure of hair follicles, such as the erector pili muscle, which the paper titled, quote, Ultrasound Image of Skin Apparatus and Imaging Basics, unquote, by Molsek and Malinowaska in the Journal of Ultrasound Sonography shows us, right? You can see a picture of the erector pili muscle. We can also note the sebaceous glands and other structures that are noted in another study by Worstman et al. Titled, quote, Ultrasound Characteristics of the Hair Follicles and Tracks Sebaceous Glands, Montgomery glands, apocrine glands, and erector pili muscles, unquote. Here we can see a side-by-side with an ultrasound image and a biopsy of the tissue. The utility of ultrasound here is breathtakingly apparent, I would say. And it's kind of cool that we can get a sort of image in ultrasound like this of the erector pili muscle, because it is theorized that in androgenetic alopecia, or in the end stage of androgenetic alopecia, where hair loss theoretically is not reversible, if the erector pili muscle disconnects from the hair follicle, then there is a sort of permanent hair loss. And this is mentioned in the paper titled, quote, Beyond Goosebumps, Does the Erector Pili Muscle Have a Role in Hair Loss, unquote, by Rodney Sinclair and colleagues, where this crucial function of the erector pili muscle is explored. And in order to prove that, maybe we have some sort of intervention that is seeming to, activate hair follicles from dormancy. Let's say PP405, for example, right? Let's say it actually does that. Can we note that there's some sort of structural change to the erector pili muscle? Is the erector pili muscle reattaching itself? Maybe, let's say, if verteporfin actually does regenerate hair follicles, is it recreating a new erector pili muscle? Like, what's going on here, right? So an ultrasound imaging technique could kind of help us elucidate that without having to do any sort of biopsy. I think all of this is important because we may not have to be invasive in such a process. And if the process is more refined, we can get a better understanding of hair loss disorders on a large area across the scalp, again, without having to do multiple biopsies. We could also combine other methods to analyze scalp disorders. So let's use lichen planipilaris as an example. This is a scarring or cicatricial alopecia, and cicatricial just means scarring or fibrosing. And here in lichen planipilaris, the immune system attacks the sebaceous glands due to a defect in a receptor called the PPAR gamma receptor, which causes for an excessive amount of lipids to build up in the tissue and create lipotoxicity. This causes for the lymphocytes and other white blood cells to come in and attack and destroy these tissues, releasing cytotoxic substances in this process, which may be indicative of an autoimmune attack. You can get an understanding of this process by reading these 3 research papers titled, quote, Lichen planipilaris and frontal fibrosing alopecia as model epithelial stem cell diseases, unquote, by Matthew J. Harris et al. The second paper would be, quote, lichen planus, unquote, by Katharina Botch et al. And finally, the third paper here would be, quote, PPAR gamma agonist and their role in primary cicatricial alopecia, unquote, by Harchuong and Shachuanat, where you can get an understanding of the PPAR gamma receptor and how its downregulation can cause lichen planopilaris, but how certain drugs like pioglitazone, if it agonizes the PPAR gamma receptor, it could potentially treat lichen planopilaris and restore function to the hair follicle. So instead of doing a biopsy to identify lichen planopilaris, we can get an understanding of the scalp by getting a large scalp ultrasound mapping of the scalp to see the areas of inflammation, as well as Doppler coloring of that ultrasound to see where excessive blood flow pooling is, which is indicative of, again, inflammation. And we can look at another study titled, quote, the suitability of high-frequency ultrasonography, 20 megahertz, in evaluation of various forms of primary cicatricial alopecia in relation to trioscopy, pilot study, unquote, by McKeel et al. And in this paper, researchers used 20 megahertz in order to evaluate the scalp of healthy individuals, as well as diseased individuals with hair loss disorders. They noticed that high-frequency ultrasonography could effectively differentiate between the structural changes associated with various types of primary cicatricial or scarring alopecia against healthy scalp conditions. The study meticulously analyzed the echogenetic and morphology of dermal and subdermal layers, assessing elements such as entrance echo, follicular structures, and dermal-subdermal borders. So essentially how the echo interacts with different parts of the tissue and how different borders are defined to say, hey, this is a hair follicle and this is an inflamed area. Just a really, really good study, and it has some pretty nice images here too. Individuals with active forms of cicatricial alopecias displayed specific patterns like cigar-shaped hair follicles, as seen in lichen planopilaris, and frontal fibrosing alopecia, as well as discoid lupus erythemia, and this is a pretty bad hair loss condition. And to kind of emphasize how good this imaging is, right? These patterns were very distinct when compared to the ultrasound imaging of healthy people that didn't have any sort of hair loss issue or follicular damaging. So it gives us some really good highlights on, yes, ultrasound imaging, especially at high frequency, is very potent in helping us understand the skin structures without having to do any sort of biopsy. So we can get real-time recording without having to excise the area, so that's a really good thing because it's really not invasive at all compared to the biopsy. And next, I want to bring up a little known non-invasive kind of method of assessing inflammation patterns and what's going on in the skin. This is a method known as tape stripping, where you can get an understanding of the gene expression in the skin. Now, whenever something happens in and on our body with our cells, the cells respond by activating certain genes, and we can use methods to check which genes are being activated, as well as which genes aren't being activated as much. So, for example, if you notice genes that are indicative of the release of cytokines, like interferon gamma, or any of the interleukins like interleukin 17, interleukin 21, and interleukin 23, this can indicate that there's some sort of immune response where inflammation is being directed at a specific area. Maybe you can see genes that are involved with the release of histamine, and histamine directs blood flow to particular tissues, right? So you're getting signs of increased inflammation. Maybe you can see cytotoxic chemicals that are released typically by the body's immune cells, like the CD8 and CD4 T cells, which in response to threats or sometimes in autoimmune attacks where it attacks the body's own cells, there are substances like perforon or granzyme B that destroy cells. Here you can be somewhat confident that there's some sort of autoimmune attack that's being observed in that area, and guess what? You didn't have to do a biopsy, because tape stripping does this by first applying a small piece of tape to the skin, which gently removes the outermost layer of the skin cells when peeled away. This process is repeated several times to collect enough cells for analysis. These skin cells are then examined to see which genes are active at the time. This method is beneficial because it's minimally invasive compared to traditional skin biopsies, which require cutting into the skin and can lead to scarring and other complications such as, potentially, infections. The tape stripping technique can reveal a lot about an underlying biological process and disease, like our example lichen planopilaris. So by analyzing RNA from these cells, researchers can identify the expression of specific genes that contribute to a disease pathology. And this approach allows researchers to monitor the skin condition over time without repeated invasive procedures. And this would be nice because sometimes disease can progress, and you might want to know how a disease is responding to a particular treatment. We can get an understanding of all of this by looking at the paper titled, quote, "Non-invasive tape stripping with high-resolution RNA profiling effectively captures a pre-inflammatory state in a non-lesional psoriatic skin," unquote, by Tossi et al. And it shows us how this method is used in psoriasis, a chronic autoimmune skin condition characterized by raised red scaly plaques of skin that is due to skin cells that are growing too quickly. We also have another study titled, quote, "Biomarker mapping on skin tape strips using MALDI mass spectrometry imaging," unquote, by Haracha et al., where the use of MALDI FTICR mass spectrometry imaging provides yet another approach to evaluating the molecular composition of the skin. And here, we are looking at tracking biomarkers directly on the tape strips that have been used to non-invasively collect samples from the skin surface. And guys, the possibilities don't just stop there. In a study titled, quote, "Scalp Microbiome and Sebum Composition in Japanese Male Individuals with and Without Androgenetic Alopecia," unquote, led by Kazurio et al., had some pretty meticulous methods that were used to collect samples from Japanese men, distinguishing them between those with androgenetic alopecia and non-androgenetic alopecia individuals. Here in this study, the protocol ensured that participants did not wash or alter their hair and scalp condition for 2 days prior to sampling to maintain natural sebum and microbiome conditions. The researchers focused primarily on the parietal regions of the scalp, particularly areas showing hair loss in androgenetic alopecia subjects. When it came to the microbiome collection, the scalp was exposed to a rubber-gloved hand, and a specialized swab was used to rigorously rub the skin to gather microbial DNA. For sebum collection, degreased cotton previously cleaned with hexene was pressed against the scalp to absorb sebum without overlapping the microbe collection sites. Now here, there were some pretty interesting insights. It showed that the sebum composition in men that were balding had higher malesthesia, and malesthesia is associated with seborrheic dermatitis. And they didn't do this, but potentially they could have used the sampling to potentially run a sort of analysis to see DHT concentration in the sebum, and even potential signs of immune activity as found by Tossi et al. In this particular paper. So again, I'm thinking here that we can combine these sort of minimally invasive or non-invasive methods of taking the skin or the outer layer of the skin, right, analyzing its lipids to see the particular genes that are being involved, as well as the microbial life, and then combining that with ultrasound imaging to give us an understanding about what's going on in the skin without having to cut out and biopsy the area. So yeah, I think it's very clear that using ultrasound technology paired with innovative biomarker gene sequencing techniques like tape stripping and MALDI mass spectrometry imaging and microbiome analysis could very well revolutionize how we diagnose and track hair loss and scalp conditions, right? All of this technology exists. It's out there. And in some cases, it has to be maybe developed a bit more using computer vision, such as the case with identifying what is a vellus hair and what is a terminal hair, right? In terms of the ultrasound imaging, the hypoechogenetic structures might not be really clear, so we probably have to get, different ultrasound pictures of a particular area to kind of map it out and get a better understanding. But essentially, yes, I think ultrasound technology has a huge applicability in tracking if somebody's going to shed hair, if somebody's going to lose their hair, if somebody's having a response, a positive response that is to treatment, or if somebody is going to be dealing with inflammation of their hair follicles and their scalp, or maybe they're already dealing with that right now. Well, guys, I've been talking a lot, so hopefully, this was useful for you and for any sort of people that are running clinical trials. I know you guys tend to watch some of my videos. Maybe this might be able to help you as well, to the researchers out there. But yeah, thanks for watching this video. I'm done talking. My mouth is completely dry. I did this sort of in one shot. But yeah, hope to see you on the next one. Peace out, guys.